And tonight, new evidence that one of President Obama's central promises, I should say another one, may be in serious trouble. Remember this one?
If you like your doctor, you will be able to keep your doctor, period. If you like your doctor or health care provider, you can keep them. If you've got health insurance, you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. Nobody is talking about taking that away from you.
Well, it's true no one was talking about taking it away from you, but it may be happening. Earlier today on Capitol Hill, several healthcare experts testified about a host of challenges, including one doctor who spoke about the shrinking list of medical options available through some of these healthcare exchanges. Listen to this.
I don't think the full scope of how restricted these networks have become is fully appreciated. We found a plan in Florida that currently has only 7 pediatricians in its network to service a county that has 260,000 children. In San Diego, we found a health plan that doesn't have a single pediatric cardiologist in its network. In San Bernardino County, we found a plan with the nearest urologist that was offered was 80 miles away.
I spent over 20 years taking care of patients. People hurt when they can't get medical care. People's health care is compromised when they can't get medical care. People lose lives when they can't get medical care. This is serious stuff.
Well, one of the people you just heard from joins me now. Dr. Scott Gottlieb is a practicing physician, a former senior policy advisor to the Centers for Medicare and Medicaid Services, and a resident fellow at the American Enterprise Institute. Doctor, good to see you. That's interesting.
Thanks
because
for having me.
that Medicare and Medicaid group that's who was represented on that conference call we just played a portion of. Those are the ones saying, right, hey, don't worry, don't worry, don't worry. And you heard Bob saying, no, there's reason to worry. You're worried for another reason tonight, and that is the shrinking network of healthcare providers that are actually in the Obamacare network. Explain.
Well, the amazing thing is that these plans were certified without having the networks in place. So they were supposed to review the networks to make sure they were adequate, and they just waved these plans through. So a lot of the plans haven't even fully formulated the networks yet. But the plans
what does that mean in plain English? What does that mean?
It means they don't know which doctors are going to be available to the people who sign up for the coverage. For the plans that have formulated the networks where they know what doctors are going to be available to you, on average, they're offering access to about 40 to 50% of the number of specialists that they offer in their older plans that are being canceled. So it's going to be much harder to get access to a doctor, and it's going to be probably hard to get access to the doctors that you used to go see. And the big issue is that if you go outside your network, the coinsurance, the cost to you could be upwards of 100%. You could be paying completely out of pocket.
Why?
And those costs, because the coinsurance is very low, the amount of money that they'll pay to offset the costs of the care outside of their very restrictive networks is typically low. It's on the order of maybe 40%.
All right, so let me interrupt you. So you got a situation where if you go outside your network, you basically can't afford it in a lot of circumstances. So you have to stay inside
Right.
your network. Now, in that testimony, you said that one low-cost plan in Florida had only 7 pediatricians in its network to serve as a county with 260,000 children. Now, that doesn't work. That's too many children and too few physicians. So the families who are trying to get their kids in, who have coverage through the exchange in this county in Florida, you're telling me basically are going to have to make it work with those 7 pediatricians?
Or you would hope that the plans are still going to try to add doctors into their networks. But they sent out these contracts to the doctors, and a lot of doctors rejected these contracts because they weren't willing to pay doctors, the customary rate. So they haven't been able to formulate adequate networks. CMS, again, the government waved through these plans. They were supposed to ensure that there were adequate networks to service the population that would sign up for these plans. That didn't happen. They just waved these plans through.
When I hear this, now this is scary to people because they don't want to lose their doctors. I mean, they didn't want to lose their plans, and once you start messing with the actual doctor-patient relationship, people get very upset. They like their doctors, they like their children's doctors, and they don't want Uncle Sam getting in the middle of that relationship, either in terms of the care being offered or the relationship itself, saying it's done because it's no longer going to be paid for. And keep in mind, the group of people we're talking about for in large part are people who were told they were going to be able to keep their plan and their doctor and that they didn't have to worry about getting messed with thanks to this law. My question to you is, when is this going to kick in? When are we going to start hearing stories about people and their relationships?
Well, when people actually go to try to access the health care that they've signed up for, I think come January, people are going to start trying to use these plans and find that they're extremely restrictive. And, you know, the only good news is that if you sign up for a plan now and you try to use it in January and find that you can't get access to your doctors, you'll have until March to drop that plan and try to find another plan. Now you'll have to scramble, and that's not, you know, really good news, but it's the only way out here.
Before I let you go, you've been a critic of the health care law, but I understand you have an op-ed coming out in the New York Times tomorrow that you co-author with Dr. Ezekiel Emanuel, one of the architects of Obamacare. So despite your differences on this law, apparently you are willing to talk about it, and you know, you're willing to shoot down certain myths about it, including which one tomorrow.
Right, it posted online, and we say that we don't think there's going to be a doctor shortage because a lot of the assumptions about the impending so-called doctor shortage make straight-line assumptions from today's resource use and today's productivity of physicians. And there's every reason to believe that resource use is going to go down, meaning the amount of resources it takes to treat an illness in the future is going to be less because of technology. That's what we've seen over time. And also doctors themselves will become more productive. That's, in fact, what we've seen over time. So you can't make straight-line assumptions from today.
Oh, they're going to have to be very productive if you're talking about 7 pediatricians for 260,000 children. Doctor, thank you.
Thanks.